How will the new buildings help patients and their families?
Thinking about patients and their families was really the key in how we thought about the entire planning of the building. So there was this underlying theme from the beginning that we discussed of elevating the quality of the environment to meet the quality of the science. And took that a step further to say coming to a hospital is not always a comforting experience, as we all know, despite how hard our staff tries. And so part of it was to utilize the building to the extent that we could, the arrangement of the programs, and the arrangement of the actual physical spaces to create a humanizing, dignifying experience for the patients. So what does that mean? What it means is, how can we reduce your stress level with the environment? How can we make it a more pleasant place to come, even though the circumstances that bring you here aren't pleasant? And how can we maybe help you forget about some of that stress that you're bringing with you? And it starts right at the front entrance of the building. And the front entrance of the building is really evocative of the historic entrance of the Billings building, right down to its brick pavers and its driveway. But it's very similar in its nature, although it's much larger in scale. It separates you from the street by using a great deal of landscaping to distract your eye, to provide some visual entertainment. It elevates from the street, again, to separate you from the hubbub of the traffic that you were just in to get here. And it tries to help orient you by the way the planting is placed, by the way signage elements are placed, by other wayfinding landmarks, and by the orientation of the actual entrances themselves. So that what we try to do architecturally is, as you approach a building, we want you to enter it about 3 times visually before you actually cross the portal. And so we tried to do that in terms of how we frame your view of the entrance, how we, as you approach more closely to the building, how the canopy defines the entrance that you're walking to, and then ultimately you get through that door. And that sounds perhaps a little nutty, but the idea is that it helps reinforce where you're going every step along your path. And the more we can make you feel like you know where you're going and that you're comforted and that you're headed on the right path, that helps to reduce your stress. The idea of having a great deal of nature is also another piece that does that. So that's just starting at the entrance. Then inside the building, this theme carries on. How do we make it simple to find your way? Daylighting is one thing. The end of a hallway isn't a blank door, but it's a window. So you walk towards the light, and as you move through the building, you have these glimpses of daylight, which if you remember the views, which a lot of people do key to, can help you reorient on your way back out. Color will be used to do that. Shapes, forms of desks, etc. will help reinforce your movement. Of course, there will be signage, but we tried to approach how people engage a building on every level. Some people use shapes. Some people really key in more to color. Others really count on the graphic information of a sign. So they're all there and they're all keyed to work together to help relieve that stress and to try and make it more friendly. Then we separated traffic, and we talked about that in talking about elevators, but there's a front and back of the house. That's for the patient's safety, that's for the visitor's safety, it's also for the staff's safety. So the public areas are very easily navigable. They're easy to find, they're easy to stay contained within those spaces, and it's easy to get out of the building from them. Then there's a level of security that you must pass through, either to be admitted into the inpatient unit or to other elements of the back of the house. That's for the staff. And so the public area is very discreet, very much the Disney concept of on-stage, off-stage space.